It's taken a few years to learn, because initially all we knew is that this broken bone nobody had healed, and if you put this magnet over the area every day for 3 or 4 months, after 3 or 4 years of not healing, it came together. But we didn't know what a stem cell was back then. We couldn't measure growth factors. So what we know is this: the cells of our body operate as a battery, and you can measure the transmembrane potential of cells and find that when they get too low, the membrane potential will lead to cancer. And when it's high, you can win races. So the trick is to find out how you can get this battery charger for everybody, because we all know when our cell phone is on the last 2 minutes of thing that we're looking for the charger. Well, all of us need the charger, and when you get the charger, not only do you increase membrane potential, which means the battery is now giving the cell the chance to put out of the cell things that it doesn't need in the cell, like too much calcium, and get into the cell things like magnesium, which mean the cell now has the energy to convert our oxygen and our food into energy, which we have a big name for, adenosine triphosphate, ATP for short. But that's the power of a cell. And we know that we increase that power when we use this over any part of your body. So if you have a tumor in your breast, you should first have somebody help you get access to a coil that we can put over your breast, and it will recharge that breast cancer so that it will take up the vitamin C that we put in your vein or in your mouth. And vitamin C, actually proven at NIH, helps kill all cancer. But if the cell doesn't get the charge, it just gives you a healthier toe, but you wanted your tumor to go away. Right. So there's an application here, whether we call it the fitness application of improved exercise or the medical application, it is as basic as life itself.
And what can this mean for the patient?
Amazingly, it can increase your circulation and decrease your pain. It gives energy to your cells. It improves bone density, so you don't have to worry about shrinking and having your spine break down with fractures and broken bones. And it gives you more flexibility. It increases range of motion, how strong you are, increases endurance. And at the same time, it gets rid of spasm, gets rid of edema, gets rid of inflammation. So it's so basic that I don't know how anyone in the future is going to practice any kind of fitness or health or medicine without making this more available to the public, because we know that you can't go in space and travel to Mars or go to the moon without having a PEMF on the ship. So if we know that we need it when you're in space, and since our Earth is losing most of its power, let's just take from what we've learned from space travel and give it to everybody.
Sounds sensible, yes. And presumably from this, it's very good for sports people and for and in that area. It's going to be a lot of benefit for pain and joints. And
it's so critical, because any top athlete, when they have something go wrong, can get out of the game, because they've got to have that elbow come back, that knee come back. So it's very important in terms of letting an athlete fulfill his potential, because a minor injury knocks him out. But more importantly, it is clear now from all the work I've been doing that every athlete can beat his own record if he first gets fully charged with the use of a PEMF. All athletes will be amazed. They will beat their own best records, because none of the cells in our body are having the luxury of a full charge. And the Energizing Buddy showed that he needed to be fully charged to keep going, and we need to be fully charged.
And are there any specific areas where PEMF is of benefit?
Well, since we've had 50 years to begin to appreciate this wonderful tool that we have, we now have studies going on in the field of heart disease, arthritis, osteoporosis, depression, cancer. There isn't any condition that hasn't been looked at now. Anyone can go to Google and put in PEMF, and they're going to get at least 3,000 studies to look at. So when people call me and say, will this help with my child who can't learn or is really stubborn, or whatever you call me about, there's probably a study that's been done about it. Because when you have something that is changing people's lives as dramatically as this, we have people scheduled for heart transplant who absolutely wind up regenerating their own heart. And we have people with Parkinson's who are totally disabled. With one treatment, almost 80% of the shaking will go away. We have people who've been in a wheelchair for years with total body paralysis called Guillain-Barré, that after less than 2 months of having their own daily application to this machine, they walk on their own power. And we have autism cases that routinely start getting eye contact, and with a few more sessions wind up actually being able to verbalize and function, because this is a key step in our whole body for cells to have the energy to do their job. Now, cells have